Hello everyone, my name is Ankit Kumar Agarwal. I like to talk about US healthcare. In the current video, we talk about the healthcare challenges in year 2022. Before we talk about the challenges, let's talk about what exactly is US healthcare. What all are the stakeholders? How do people get insurance coverage? What kind of capital expenditure is made on the US healthcare? And when we deep dive into the healthcare challenges. When we talk about US healthcare, we need to first understand various stakeholders. Patients, they need to be covered by the insurance provided by the payers. Once the patient needs a medical coverage, the patient approaches the providers which are part of the payers network. The providers provides the coverage and submits the claim to the payers and get paid based on the claims adjudication. There are various other stakeholders which are part of this value chain. It could be pharmacy company, biotechnology company, manufacturer, and the distributors. When we talk about the US health insurance coverage, roughly 48% of the coverage is provided by the employers. 15% coverage is provided by federal sponsored Medicare program. 15% of the population is covered by the federal and state sponsored Medicaid program. 2% coverage is provided by the other government sponsored program, which includes Veterans Administration program for the military, and 5% coverage is non-group, and 15% of the population is still uninsured. Talking about the US healthcare expenditure, in the year 2022, we are expected to spend almost 5 trillion US dollar on healthcare expenditure. United States spends maximum in terms of per capita comparing to any other country in the world. We are expected to spend almost $9,403 per person in the healthcare expenditure in the year 2022. The healthcare is very expensive. We spend almost 5% of that care in the care facilities, 10% on the prescription drugs, 32% of the coverage goes in the hospital care expenses, and 20% in the physician services. In all, we spend a lot of money on healthcare, which is a significant portion of our GDP, but still at times we find the healthcare is lagging. What all are the reasons and the challenges due to which we face these issues? The main issue is lack of interoperability. We have various stakeholders who manages various aspects of members' healthcare information, whether it's the providers, payers, pharmacy, biotechnology company, everyone has the data. Now, why don't we have a single landscape where everyone can share the information in a interoperable format? Is it lack of desire to share the information with all the stakeholders, or is it lack of interoperability standards? In the coming series, we'll talk further about it. But apart from these challenges, the challenges faced by the patients or members are data breaches and ransomware attacks, which are way more prevalent in year 2022, and also extensive use of mobile devices without authentication and authorization, which leads to the data breaches and misuse of member information. At the end of the day, we all are involved in this process. We need to make this process better. How can we make improvements in the US healthcare process? Let's join hands together to work on improving the healthcare, to improve the interoperability and improve the healthcare landscape altogether. Thank you very much. Until next time, have a good night.